The purpose of the chair sit and reach test is to assess lower body flexibility, primarily of the hamstring muscles. Equipment required includes a folding chair with a seat height of 17 inches, with legs that angle forward to prevent tipping, and an 18-inch ruler. Begin the demonstration by placing the chair against a wall to prevent slipping. Instruct the participant to sit on the front edge of the chair. The crease between the top of the leg and the buttocks should be even with the edge of the chair seat. One leg is bent with the foot flat on the floor and slightly out to the side of the body. The other leg is extended as straight as possible in front of the hip. The heel is placed on the floor and the foot is flexed at approximately 90 degrees. The participant should place one hand on top of the other with the tips of the middle fingers even. Then slide the hands down the extended leg in an attempt to touch or reach beyond the toes. The reach should be held for 2 seconds. Have the participant practice stretching on both legs to determine the preferred leg, which is the leg that results in the better score. This leg will be used for scoring purposes. Once the preferred leg is determined, administer 2 practice trials before scoring the test. Using the ruler or yardstick, administer 2 test trials and record the better test score. Measure the distance from the tips of the middle fingers to the toe end of the shoe to the nearest half inch. The midpoint at the top of the shoe represents the 0 point. If the reach is short of the toes, record the distance as a minus score. If the middle fingers touch the toes, record a score of 0. And if the reach is past the toes, record the distance as a plus score to the nearest half inch. Follow these safety tips. Place the chair securely against a wall so it doesn't tip forward when a person sits on the front edge. Remind participants to exhale as they bend forward and to avoid bouncing. Tell participants not to stretch to the point of pain. Do not test those with severe osteoporosis or those who have pain when flexing forward. Get down beside the participant and gently place one hand on the knee. If the knee starts to bend, have the participant stop or pull back if necessary. If a participant cannot fully extend the knee, measure the approximate flexion with a goniometer and note it on the scorecard. To measure knee flexion using a goniometer, align the stationary arm with the lateral side of the thigh, and align the movable arm with the lateral side of the lower leg. Measurement is in degrees. If you don't have a goniometer, just estimate the flexion on a scale of 0, of no flexion, to 5, a lot of flexion. If a participant is visually impaired, ask if you can touch him or her to help direct. Allow a participant to perform the test from a wheelchair with the wheels locked, or a walker with the seat if needed, noting the adaptation in the scorecard. Repeat the demonstration for people who have difficulty following directions.